very much, Dr. Shell. It's always great to hear you speak about the international burden of diabetes and what you're doing to that. Speaking of that, our next speaker is Professor Sehnaz Karadeniz. She's a wonderful advocate for diabetes and always has a smile on her face. She's the chair of the International Diabetes Federation in Europe, and she's the president-elect of the International Diabetes Association. She's a professor of ophthalmology at Istanbul Bilim University and a founding member of the Board of Trustees of the Turkish Diabetes Foundation. She's going to be speaking to us today on our strengths and opportunities as the diabetes community. Professor Karadeniz.
Thank you so much, Professor Becker, for the nice introduction. And I want to thank to the organizing, Professor Sehnaz and the organizing committee for inviting me and giving me the opportunity to address you. The growing diabetes numbers, as emphasized by Professor Namcho, are a threat for the well-being of the citizens health services and national economies in individual countries. More worrying than this are the predictions for the future, again as emphasized by Professor Namcho. If we look to the predicted increases for 2045 in African region, it's 156% increases in predicted. This is really very bad if we think about the public health. But instead of these depressing and demotivating facts and figures, I want to speak more about the strengths and the opportunities of the diabetes community. I'm sorry, there's something wrong with the... Yeah, there's something wrong with the... Okay, anyway. According to the 2017 edition of Diabetes Atlas, there are 425 million adults with diabetes worldwide, and this is the third largest population in the world after China and India. It is higher than the total population of the USA. So we are too many to push our cause high on the public agenda, be it local, national, regional, or global. On the other side, there have been also several declarations, resolutions, and recommendations, starting with Sehnaz Declaration in Europe back in 1989, and I want to again say thanks on behalf of the Diabetes Committee to Professor Massimo Massi Benedetti, because he was the chair of IDF Europe at that time, and they have achieved this together with the WHO Europe. And at the end, we have all these at the regional and global levels, inviting member states to take action against diabetes, to prioritize diabetes as a major public health concern, and to develop a strategy for diabetes prevention, diagnosis, and control. But what about the reality on the ground? In 2017, IDF Europe region, as the IDF European region, we published a report in order to understand and analyze the barriers in translating the evidence base into real life in Europe. We also run IDF members, a survey of IDF members in our region, and one of the questions we ask if they consider diabetes to be a national priority in their own countries. But unfortunately, The answer was a medium priority. So many years after all these political commitments, the diabetes community still perceives diabetes to be of medium priority in their respective countries. Often people are unaware of serious issues facing their communities, and in these cases, it's crucial to raise awareness, gain community support, and put the issue on the local, national, regional, and global agenda. In this respect, NGOs like us are very important. I want to emphasize here the importance of the national diabetes organizations, IDF. Is this because of me, or is there something wrong there? It's jumping. Okay. Organizations like IDF, an umbrella organization, which is there in more than 170 countries, and the number of national organizations under the umbrella of IDF is about 200. But the main strength of IDF is, of course, the members, our national members, and the regions which come together and make the whole global IDF. So we are a big organization altogether to push our agenda. A wonderful example about what we can achieve together is the UN resolution back in 2006. On December 2006, the United Nations General Assembly passed a resolution that recognizes diabetes as a chronic, debilitating, and costly disease associated with major complications that pose several risks for families, countries, and the entire world. Governments have acknowledged that diabetes is increasing at epidemic rates and is affecting all countries. For the first time, a non-infectious disease has been recognized as a global threat, as infectious epidemics, as in HIV and AIDS. And at the regional level, lastly in 2006, in Europe, the written declaration on diabetes adopted by the European Parliament with the immense efforts of the IDF European region, and at the end signed by more than 400 members of the European Parliament. And I say by the efforts of the IDF Europe region, of course this is the members. Members have pushed their MEPs in their respective countries. And that again calls the European Commission and the European Council to prioritize diabetes as a major European public health concern and to develop an EU strategy for diabetes prevention, diagnosis, and control. These are wonderful steps forward to build on, but unfortunately several of the commitments, like a national plan in individual countries or a sub-regional like EU strategy for diabetes, are not yet implemented. Coming back to the report of IDF Europe, only 22 out of the 38 European countries that have responded to this survey had a national diabetes plan or strategy for diabetes. And unfortunately, although the number may look promising when compared to the previous years, the structure and the target population for these programs varied. So we are still not there where we want to be. 10 included the general population, 19 included populations at risk for developing diabetes, and 22 included people with type 2 diabetes only, and 17 included persons with gestational diabetes. And more importantly, monitoring is very important. and only 60% of the responding countries said that their national diabetes plans are monitored, and the same number evaluated their impact. So we have still a long way to go. Another strength of IDF is, or the diabetes committee, better say the diabetes committee, is to have IDF plus its regions. We have 7 regions established with the aim of strengthening the work of national diabetes organizations regionally and enhancing collaboration between them, as each region has its own dynamics. And I strongly think that strong regions contribute for a stronger global organization and vice versa. When we come to the European region, with 69 members in 44 countries, we are a wonderful mosaic in Europe, representing cultures, different healthcare systems, low resources, high resources countries, and so very rich in different experiences, so many things we can learn from each other in our region. And also, this should be, of course, there are good collaborations also between the regions at the level of IDF, but we should also strengthen this because there are wonderful examples all over the world at every corner. Yesterday I was speaking with Professor Mohamed Sandil, and we know the efforts from Nizar Al-Bashe and Professor Mohamed Sandil for the immigrants. And then this is a problem right now in many countries, including Turkey and many other countries in our region and also in other parts of the world. Besides executing IDF global vision and mission, we are also focusing on issues specific to our region in Europe. We are trying to advocate, besides individual countries, also at the regional institutions, like in our region, the WHO Euro, European Parliament, Council of Europe, and the Interparliamentary Assembly of CIS countries together with the members. This is what we are doing in Europe and in other regions. There are also regional institutions. So as the members and the regions, we can do a lot in these institutions. A good example of what we can achieve together with the member organizations and the excellent human resources there is the forthcoming event on November 14th in the European Parliament. As IDF Europe, we organized this session on improving the well-being of people with diabetes and those at risk under the auspices of the Finnish presidency. Thanks to the Finnish Diabetes Association and Maria Stenius Kaukonen, a person with very much dedicated person with type 1 diabetes, and who also served as an IDF Europe board member back in 2004. So we had this for the first time in Europe under the auspices of one of the presidencies, and I want to thank again Massimo here because he will be one of our speakers there. He accepted to speak there. Another example, what we can achieve together with the members is this meeting at the Lithuanian Parliament this May 2019. And as IDF Europe, we have also signed the appeal of the Lithuanian Diabetes Association to support their activities in their countries, and together with the Lithuanian Diabetes Organization, we hope that we will have we can achieve several things in Lithuania because there are some problems with their national reimbursement systems and also national health services. But as the region, as global, together with the member associations, I think this is one of the things showing what we can achieve together and what our strengths are. Of course, the youth are playing an essential role in raising awareness on diabetes and also their potential to urge stakeholders and the general public to take action on diabetes. Their broad network and their out-of-box thinking makes them more creative and can support ideas and regions and national organizations outreach. At IDF Europe, we are organizing the youth leadership camps since 2011. Next year we will have the 10th edition. And I'm very happy to say that last year the camp was organized in Istanbul, in my country, with the support of the Turkish Diabetes Foundation. We have also established a youth group in Europe, which is also part of course, there is also a wonderful youth program going in the global level, but this is the regional one. And we have established this youth group in the region with our camp alumni, and also other youths joined us, nominated by the members in Europe. They are developing wonderful projects. One of them is the Diet Traveler. This project aims to create a space where traveling is made easier and safer for people, young people with diabetes, by being connected to a local member, as well as allowing members to make international friends. Another strength, the vision of idea, is that as idea we know what we would like to achieve together and accomplish over time. In this way, we provide the outside world with some insight about our goals, and this also serves for their perception about us. The vision of idea is living in a world without diabetes, although it sounds a remote possibility with the current numbers and predictions. At least we know where we want to go. I want to emphasize here the Western Pacific region with a predicted increase of 15% in the number of people, of adult people for 2045. This is quite good when we compare this to other IDF regions. So we should not give up, but more concentrate on the barriers and how to overcome them. We already have a mission as well, which is promoting diabetes care, prevention, and cure worldwide, meaning that we are doing, what we are doing in order to achieve the vision. So as the global organization, we know why we do and how. Now, again back to IDF Europe. At the beginning of this term, we had a lively discussion with the board and the office on vision, objectives, the library, and what matters to the members in the region for this term. And as a vision of the term, we said improving the lives of people with diabetes and those at risk. And we set the priority objectives for the term to achieve together with all IDF members in the IDF European region. Diabetes, another strength is that diabetes is in all living areas. So that's why what we have done at IDF Europe, especially in the last term, is to use every opportunity to give the public in Europe the message that we are everywhere. So we use the World Health Day, we use the Children's Day, the International Women's Day, Migrants Day, and especially the Migrants Day, because this is a huge problem for Europe. We have communicated the Council of Europe. So what we have done is, tried to do is, because you need to allocate a person to the office, so therefore we couldn't make it as much as we wanted. What we have done is, for example, if there is a World Sight Day, we try to communicate the ophthalmology organizations to link it with diabetes. So the same thing for World Refugee Days, Mother's Days, Father's Days, World Kidney Days. So there are so many opportunities where we can bring up diabetes on the agenda and link it to any of these issues. Partnerships are very crucial to make our voice heard more strongly and helps to create synergistic effects. And every partnership, of course, brings along new ideas, innovative ways reaching out to our goals. At the global level, I want to emphasize only two continued big partnerships with the permission of NAM, our president. One is the Fred Hallows Foundation and the IDF. One of the first achievements of this collaboration was the Diabetes Eye Health Guide, and still there are several things running with the Fred Hallows Foundation. And the second one is the Lions Clubs International. This is very important because lions are everywhere. And in 2018, Mr. Naresh Agarwal, the president of Lions Clubs International, and Professor Nam Hancho have signed a memorandum of understanding to establish a cooperative alliance in the global fight against diabetes at the national, regional, and global level. This is very important because, as I said, on one side, their numbers are high, but most importantly, they have several funds. So this can be one of the ways to support our activities locally. When I come to IDF Europe, we also established several partnerships at the regional level, both for diabetes advocacy and also for working with the wider health organizations. And at the end, most importantly, we are dealing with a health issue where good care does matter in order to maintain a good quality of life of a person with diabetes. So I want to bring this to your attention. This is our second president of the Republic of Turkey. And he had diabetes for more than 50 years. And he was diagnosed many, many years before when there were more limited limited diabetes medicines or medical devices, but still he had a very healthy life. So thank you.